vagina. Okay? You're going to clean the vagina and the buttocks. Alright. So you let the client know what you're going to do. You're going to go do hand washing technique. You're going to come back, ask the client if you can check the ID and make sure that she is the correct or he is the correct client that you're going to work on. After that, you're going to bring the bath blanket to the bed. Don't forget to provide the privacy. Lock your wheels. Raise the level of the bed. Cover the client. Move the sheet down to the feet. Now, this particular client, the reason why you're going to do perineal skill is because the client has urinary incontinence. They're always urinating on themselves. So they're on a chuck, but the chuck is wet. It has urine on it. So you're going to put on some clean, fresh gloves. And you must remove the soiled chuck from underneath her and put a clean mattress pad. So that's what we're going to do now. So you're going to cross the arms and the legs in the direction that you're going. So I'm turning her away from me. Shoulder and hip. Shoulder and hip. You're going to count to 3. 1, 2, 3. Turn the client. You're going to roll the dirty chuck away from you and place it underneath the client. Tuck it as far as you can. Then you're going to bring the clean mattress pad, just like when you're doing bed pad. Same thing. You're going to roll this towards you. Do the same thing with occupied bed making. Roll the dirty away from you, roll the clean towards you, and tuck underneath. Hold the client. Tuck as far in as you can. Inform the client that you're going to turn them back. Hip and shoulder. Hip and shoulder on the count of 3. I will turn you back on your back, okay? 1, 2, 3. Chuck in the garbage. Clean mattress pad. And ready to begin. Grab one end, bring it up, and make the triangle look for effect. Ask the client to flex or bend the knees. Right. You check the water. Water's great. Washcloth. So, gather. Only expose what you need to expose, which is the vagina.
Ms.Jones.
You're going to
No.
open. When you open, one finger straight down. Okay? That's to clean the middle inside of the vagina. Bring this down, back in the water, Re-wrap, get some more soap. You're going to open one finger, the farthest labia from you, which is this side. And you're going to clean straight down. Then you're going to use the pinky. You're going to go on the other side, straight down. And the water. You're going to get more soap. Now we're going to wash the outside. Right here. Open your hands straight and wash down. Back in the water, relax, get some more soap. The other side, straight down. New washcloth. And rinse all the soap off.
You don't have to change the water?
Remember, you're using minimum soap. Only time you change this water if it becomes very soapy, cloudy, or cold. Open, wipe. Back in the water. Remember, you're rinsing. Open, one side. Then the other. One side of the towel. Open, pat dry. Pat dry the outside. Leave the towel here on the bed. Do not put it back here because you will contaminate the area. Ask the patient to relax, lay down, legs, and we're going to turn the client now. We got to do the back side. Ms.Jones, on the count of three, I need to turn you over so I can clean the back side, okay? 1, 2, 3. Turn the client. You're only going to expose the area that you need, and that will be what? The bottom. Right? So now, remember when you started this, the patient was what? Laying on a wet chuck. So all the cheeks have urine, and you have to clean also what?
What was it?
Rectum. The rectum.
What was it?
Get up. No, you got to get up. This is not a sitting skill. Get up. Alright, so cover. Now at this point, before you turn the patient, if you feel the water's gotten really, really soapy or cloudy or cold, my best thing is to say it got cold, the water. She can't put no cold water on the client. And if she gets up and puts on a glove and tests the water and the water's cold, you fail. I want you to know that. Okay? So there's supposed to be a certain temperature for hand washing, a certain temperature for partial bed bath, and a certain temperature for perineal skill. There's all three different temperatures. You should know what they are. You might see it again, like state board exam, right? So at this point, before you turn the client, you will have to lower the bed, of course. You will go over there. You will get rid of that water in the commode because it has vaginal fluids in it. You will rinse everything the way you're supposed to do, collect new water, come to the client, let the client touch the water, and then you proceed, which is where we at right now. So we're getting ready to take care of the buttocks. You're going to clean the cheeks first. Cheeks are first. You're gonna get soap. Which cheek is first? The farthest from you is the one that is closest to the bed. This cheek is the farthest from you. This one is the closest to you. So you're gonna clean this one first. You're gonna hold on to the client from the bottom where you sit, from the bottom all the way up to the top of the cheek. Okay. Cover the patient, back in the water, relax, get some more soap. Back in the water, relax, get some more soap. Now, you're going to see the client. You have to expose the area. You have to take your hands and you have to spread the cheeks open. You're going to go from the bottom of the vagina upward and scoop, like a scoop motion. Scoop, right? Just in case there's any other materials there besides just urine and dirt. There might be feces there. She didn't clean right, it's coming out, whatever, okay? Back in the water. I will do this twice if I was you. Get more soap, open, and scoop again. Make sure you come up all the way to the crack, okay? In case anything is there. Okay?
The hand is getting big for the shower.
Yeah. We're going to rinse. Up. Back in the water, rewrap. Back in the water, rewrap. Open. Scoop. All the way up. You might want to do it twice. Open. Scoop. Bring the towel. Now, you already used this portion, right? So you're going to fold this one over and use this portion now. You're going to dry. Open, pat dry the middle. Please try to get that as dry as possible. Do not leave no moisture because this will develop a bed sore.
Okay.
That's a developing bed sore. That's what they look like. All right?
Okay.
You're going to leave the mattress pad. At this point, I will remove my gloves. And I'm going to put her down. 1, 2, 3. You okay, Ms.Jones? No. Back and forth, back and forth. I know you're tired. I'm done. Okay? Just going to get you fixed up. And it's over. Okay? Try to talk to the client as much as possible. Yeah.
Is the pad is for urine too? Or comfort?
No, for the urine.
You have to talk.
Because she has urinary incontinence, so she's going to continue to leak.
So that and
Okay, give me.
Yeah.
You.
Any kind of fluid that's coming out of the body, it will take it.
Oh, Ms.Jones.
Wait, 1 second. So now, you're going to get rid of this. You're going to put on fresh, clean gloves, right? You're going to go to the sink, tissue, turn on the faucet. This stuff in the commode. You're going to put some water, commode. Water, soap, tissue, wash, commode. Next water, rinse it, commode. The last water in the sink, tissue, dry. Personal equipment, take off the gloves, do hand washing technique. Come back to the client, open the curtain, give her her call bell. Lower the bed should be lowered anyway before you walk away from the client. That's why I took off my gloves. Make sure the bed is completely lowered. Wash your hands and tell the proctor the skill is complete. Questions?